Let me start by introducing myself. I'm Susan Thomas, and I lead Google's work in health here in Europe. I'm part of the health team, reporting into Google's Chief Health Officer, Dr. Michael Howell, and I lead a team of clinical AI specialists who work alongside our product and research teams to make sure we're building the best and safest products in health. I'm a clinician by training. I trained as a geriatrician before moving into this world. Many of you may not have even realized that Google actually did work in health, though. So I'm just going to start and spend the next 20 minutes talking about the work that we do and how we see AI shaping health, because it's really at the heart of a lot of what Google is doing. Our goal in health is very simple. It's billions of healthier people. And whenever I show this slide, I feel a little bit like bombastic. It feels like a little bit like billions of people. But actually, when you think about Google, we have the scale and the ability to do that. Every day, 1 billion people turn to Google search with a query about their health or wellness. 1 billion people. And they're not just questions like they used to be, where you just write diabetes or cancer. People now write things like, my mum's just been diagnosed with lymphoma and she started on this treatment and she was due to go on a cruise with her friends around Portugal. Are there any problems with that? Right? These are complicated questions, and you'll all have seen when you go into Google and do that sort of question or any sort of question, you'll get an AI overview often appearing where the summary from some of the links appears. That surfaces a lot in health because people want their information in a way that makes sense for them. More than 1 trillion people have watched health videos on YouTube. So you can kind of start to get a sense of actually Google is at that scale where perhaps we can drive billions of healthier lives. And we do that by research. We are really proud of research. We publish a lot in top-tier scientific journals, Nature, Publications, JAMA. And we are also, in this bit at the bottom here, Nature do an index for corporate global research output. And Alphabet/Google is ranked 4th in that. And that's something we're really proud of because it sort of embeds what we do. It sort of grounds what we do. So I'm just going to talk a little bit about how we see research shaping health now. So one of the things that we think is really important is how do we empower the global community with medical intelligence? It would have been remiss of me to come to this and not talk about AlphaFold at a conference like this about researching. All of you will know that one of the grand challenges was around 3D structures of proteins and trying to solve that. Why is that important? Proteins are the building blocks of life, and in order for us to be able to develop appropriate cancer therapies or targeted therapies, being able to understand their 3D structures and how the amino acids stack up was really important. It used to take a PhD student 3 years and $100,000 to just map out one protein. It was going to be a really long endeavor to get to where we needed to. So Google DeepMind decided to use AI to try and help solve this. And in 2021, AlphaFold 2, in less than a year, was able to accurately map the 3D structure of over 200 million proteins. Quite astonishing. And Demis, who Steffi just referred to, and John Jumper were awarded the Nobel Prize for Chemistry in 2024 as a result of this. I just want to kind of stop on that point. When Watson and Crick discovered the helix structure of DNA in the 1950s, they weren't awarded their Nobel Prize for over 10 years later because it took that long for that information to permeate out and really make a difference. This is making a difference right now, and that's one of the things about AI is the scale of transformation that it can cause. Over 3 million researchers in over 190 countries are now accessing AlphaFold via EMBL, which we're really proud of. Researchers here in Munich, no less. MedGemma is a tool we're also really proud of. It's our most capable open model for multimodal medical text and image comprehension. It's a small open weight model based on Gemma, which is our general all-purpose open model. And we've then tuned it with data sets like chest x-rays, pathology slides, EHR data. And researchers around the world are now using it. So in Taiwan, people are taking it and working with traditional Chinese language medical literature. In India, the All India Institute for Medical Science have developed oral cancer screening using MedGemma, which is now being rolled out across a number of states. It's not an out-the-box model. You have to take it and put more data in and fine-tune it further, but it's really helpful. So why would you use this model rather than one of the big foundation models like Gemini? Well, if you need a lot of compute because you've got a lot of data, it can be much more effective from a cost perspective. But also, we know that lots of places need to think about sovereign data. It can be really helpful to have open source models that you can version. We also think of AI as a collaborator. Amy, our Articulate Medical Intelligence Explorer, which is a right mouthful, is an agentic system that we have been researching and building over the last few years. It basically is an agent that is able to hold multi-turn conversations with patients to come up with a diagnosis and treatment. It's based, we trained it using the OSCE process. Any of you who are doctors in the room will remember being a medical student and going through objective clinical examinations, structured clinical examinations. And whilst it's only a research product at the moment, we have completed a IRB feasibility study with BIDMC in Boston, which was really successful. We used actors to simulate patients. Amy took histories from them, all observed at all times by a primary care physician. And because of the success of that, we are now rolling out with Included Health, who are a leading telehealth provider in the US, a 10,000-person study of people who are seeking care. They come to Included Health, and we then consent them, and they either get seen by a regular primary care doctor or go through the Amy process. So we're really hopeful that at some point in the future that there will be the ability for doctors to scale their impact by using tools such as this. But it's not just about cells or individual proteins or individual patients. We also think about things from a planetary scale. We've built a series of tools called Earth AI, a series of foundation models, where we've basically combined different data sets to build these sort of time and spatial models that are helpful for predicting things at a population level. And the one on the screen here, the Population Dynamics Insight model, has combined different data sets, some of which are proprietary to Google, but some which aren't. So search trends, air quality data, weather trends, map data, etc. And by putting all of those different data sets together, which each have their own value on their own, it becomes even more powerful by combining them. And they form an embedding that you can then form what we think of as like a fingerprint or a signature of a local place, down to zip code or postcode level. And that allows you to take action. You can add local data and understand things more clearly. You can do risk stratification, say, for diabetes or other long-term conditions, flood forecasting or crop outcomes due to rain patterns, health access, and so on. And again, we're doing this in partnership. So we've been using, in conjunction with the World Health Organization and the Gates Foundation in sub-Saharan Africa, some of our models to look at cholera risk prediction and polio virus risk modeling. The cholera risk prediction was amazing. We basically took sort of the history of the previous cholera outbreak, put it into our Earth AI models, and we're able to more accurately predict the spread of cholera than had been done previously. So we're really hopeful that, say, with Ebola, as that comes through in DRC, we may be able to really help contain some of these by spotting new hotspots. And the bottom one here is looking at measles vulnerability mapping in the US. We know that there's been a real downturn in the uptake of MMR. So this has been a really important piece of work for us with Boston Children's Hospital, where we've been able to localize areas where measles outbreaks have been happening. And because of that, we're hopeful that public health interventions can really start to impact, and we can actually target for better vaccine uptake. And finally, partnerships important to us. We know that we are better when we partner with organizations, and we are thrilled that we have partnerships here in Munich. We've partnered with TUM over the last year to look at how we can build evaluation and benchmarks of clinical products that are built out of generative large language models. And we're doing that because it's really important that there's a transparency around these models. How do we evaluate them? How do we know that they're safe? How do we know they're not delivering harm? And the more that we can do that in a public and transparent way, the more trust we get in the scientific and research community, but that also permeates out into the general public. So it's a really important thing for us. And then our other partnership here is with Helmholtz, where we are looking at single-cell foundation research around single-cell genomics. So we are thrilled, I'm genuinely thrilled that we're able to come to Munich and celebrate these partnerships. So that's some of the research that we're doing now, and I'm just going to spend the last few minutes of my talk, if I may, thinking about where AI might take us next. If we were to be back here in 2 or 3 years' time, what would be the things that I would be talking about then that Google are doing? And I've touched on some of them already, actually. Sort of the rate of change is so quick that it's almost impossible to think what it will be like in 3 or 5 years' time. But here are some things that we think are going to be happening over the next while. And I've talked about a couple of these already. The second one here, where time and space, we think that they're going to be first-class variables in models. Well, those Earth AI models, we absolutely are already seeing that you need to think about not just text and linear progression, you need to think about time and space, and much more research needs to go into that. But the first is that we know already that models are going to continue to improve at an astonishing pace. The line across the top is sort of the human baseline, and the red box is sort of the last few years. And you can start to see how quickly models are coming up to human-level performance. We've got here competitive maths and PhD-level science. They are reaching and overtaking human-level performance. And it's happening at a speed that is almost incomprehensible for people like me who are neither scientific nor technical. A couple of weeks ago, and I feel a bit embarrassed even saying this, but I vibe coded using anti-gravity, which is one of Google's tools, an agent that overnight trawls my inbox, my chat, my drive, and my calendar, and comes up with a list of things for me to do the next day, sort of strategic priorities, operational priorities, and sorts out my calendar. I literally have no idea how it did that. I don't understand the code behind it, but it works, and it's made me hugely more efficient in how I'm working. So we've gone from a place probably a year ago even, or maybe even 6 months ago, where doing things like that was the domain of deeply technical engineers, and now heathen like me can do it too. We're going to see new interaction patterns. There used to be almost, and I think this is really relevant for health. It used to be that the patient-doctor dyad was almost like a sacred thing, right? You would go and see your doctor and you would trust in everything they said. Doctors were on pedestals. And we're seeing that move to a sort of the doctor-patient AI triad. I talked about Amy and how people are trusting AI to start to do their diagnosis. People are trusting Gemini and ChatGPT to start to do their diagnosis. There was a study done by Gallup recently in the US where 14 million appointments were shown to be missed in the month of March by citizens in the US because they had chosen to use, or not missed, but just not taken up because they'd chosen to use ChatGPT or Gemini and felt that they had enough information. If you scale that out over a year, it's about 10% of all doctor appointments. So already some people are choosing to trust AI in how they are thinking about their health. So what might this mean for health? And again, we've touched on some of these already. Dramatic changes in how we do our work. I'm building agents. Who would have thought that? Biological discoveries at an unprecedented pace. I talked about the speed with which AlphaFold was able to map those proteins, and we are seeing things like that sort of happen in even shorter time frames. And again, if just to pick on a couple, we have definitively moved from an era where patient-reported outcomes, sort of verbal or form filling of patients and how they were post-op or at any point, or they'd see a doctor intermittently, say at 6 monthly intervals for their rheumatoid arthritis. If you go and see a doctor for your rheumatoid arthritis and you don't have any pain because you're not in a flare-up, the way you'll report that to the doctor will be very different to if you're in a flare-up of pain. The information that we can get from wearables, like watches or continuous glucose monitors and others, are astonishing. And you start to combine those with, say, genomics information and EHR information, and you can start to really change the face of health. And then this one I think is really important. We'll see a leveling of asymmetry of information around healthcare globally. I talked just now about the sort of the doctor-patient relationship and how doctors were sort of on the pedestal and owned all the information. When I was a junior doctor in the UK, we didn't let patients see their medical records. They would ask and we'd say, no, they're not yours, they're ours. A patient would have to make an application to the hospital where they were being treated or the primary care where they were being looked after to see if they were allowed to access their medical records. And we had the ability to say no, that they couldn't. It's astonishing that that was the case. And that's, I'm getting old, but it wasn't that long ago. Whereas now, people, for the last few years, people have come to see their doctor and they've Googled their information. They've come with some knowledge. Now that's changing even further. This is a LinkedIn clip from somebody who posted about how Google and Gemini stopped their dad going blind. His dad had woken up, had some black spots and a cluster of symptoms. He was due to go off and play pickleball with his wife and some friends, but thought, I'll go and see the doctor later, but maybe I'll just search. So he just searched in Gemini, and Gemini said to him, the cluster of symptoms you describe could be potentially very serious. You should see a doctor. So he didn't go and play pickleball. He went to see a doctor who diagnosed a retinal detachment, and he got treated really quickly, and he didn't lose his sight. The thing on the right, is from somebody replying to him saying, my dad had exactly the same 3 years ago, didn't have the opportunity to ask Gemini. Now, before my PR colleagues from Google jump up or the legal team, I just need to say, Gemini is not intended to diagnose or treat, and it didn't here. It just said, go and consult a doctor. It is a general purpose AI model. But we can see where this is going, right? And perhaps, after all, it isn't that hard to see how all of us together, using AI, can start to see how billions of healthier people will happen. Thank you so much for having me here today. There was one more slide, but it's gone. There was a QR code I was going to try and show, and I don't know whether we'd be able to get it back up. If you want to keep in touch with us on the work we're doing globally or here in Germany, please, there's a form here. We've got an event that we're hosting in Berlin later in the year. Please do keep in touch, and thank you so much for having me here in Munich.